Hi everyone. So today's video is going to be about a very commonly asked question on many social media platforms, especially from students who are interested in psychology, and many professionals have tried to answer this. So I have gathered a few resources from which I have collected information, and I'm going to be presenting today's video. So the question is, what exactly is the difference between a clinical psychologist, a psychiatrist, a counseling psychologist, and a psychologist? So these are the four common terms that we often come across, and today we'll try and understand what exactly is the difference in the roles that they play. Right? So stay tuned, and thank you for tuning in. Okay, so we will begin with distinguishing what are the educational qualifications of these four sectors that we are going to talk about. Number one is I'm going to start discussing with clinical psychologist. So, for practicing as a clinical psychologist with respect to Indian context, that is in India, the person needs to have an MPhil in clinical psychology and from a RCI recognized institution to easily get the RCI license. If the person is doing it from a non-RCI recognized institution, then there are different procedures as to how they can probably apply for an RCI license. They have to sit for a couple of exams. The process becomes a little complicated and difficult when it comes to that. So remember, not to make it very complicated for you all, clinical psychologist, someone with MPhil in clinical psychology with a RCI license, right? Now, second coming to is psychiatrist. So what are the qualifications of a psychiatrist? MBBS, DPM or MD in psychiatry. So basic qualifications that differentiates clinical psychologist from a psychiatrist is this. Psychiatrist needs to have an MBBS, a DPM or an MD in psychiatry. Now, coming to who is a counseling psychologist, with reference to the education qualification, someone who has a MA or a MSc in counseling psychology or an MA or MSc in psychology with specialization in counseling. And this is something that many people debate about, because there are a lot of courses, a lot of online distance education programs that offer counseling, or there are short-term courses on basic counseling skills. And the sad part is there is no regulatory body in India that actually clearly defines who can be called as a counseling psychologist, just like it is clearly defined for a clinical psychologist. So I referred to American Counselling Association, where this criteria was given, and hence I'm referring from there. Now coming to who a psychologist is in terms of education qualification, someone who has a MA or a MSc in psychology, they can choose to specialize in different areas like counseling, and if they have additional courses that they have done from recognized or authentic regulatory bodies, certain kinds of therapies, or specializations with in context to organizations and things like that, so that counts for a psychologist, that is having a MA or a MSc in psychology. Right? Now we'll quickly try and understand the different roles that all these four individuals are playing. So a person who is a clinical psychologist is trained to diagnose and to basically treat any kind of mental illness. So mostly these people work in hospital setups, government as well as private, and they can also practice independently in their private clinics. Right? They are trained to administer psychodiagnostic tools or psychological assessments to basically diagnose the mental illness, and then also provide psychotherapy. Mostly they when they are working in hospital setups, they work in collaboration with the psychiatrist. Now, understanding how the role of a psychiatrist is different from a clinical psychologist, a psychiatrist will be also be focusing on the diagnosis and treatment of mental illness, But what differentiates a psychiatrist from a clinical psychologist is that a psychiatrist is allowed and is trained in medicine, so they are allowed to prescribe medicines. A clinical psychologist cannot prescribe any sort of drugs or medicines. Neither can they stop the drug or medicine without consulting a psychiatrist. If they are working as a team, they work as a team together, and they collaborate, and the main aim is obviously diagnosis and treatment of any kind of mental illness that a person is going through, right? I hope that was clear. This was based on research that I have done after reading the mental health bill, also after some guidelines of RCI. Now coming to who a counseling psychologist is, and basically in terms of the job role. So the focus of a counseling psychologist will be to deal with any kind of mild to moderate issues, mostly revolving around daily life matters. Any kind of emotional issues related to stress, trauma, interpersonal conflicts, relationship issues. So you can easily divide them as to providing individual counseling, family counseling, or psychotherapy, then career guidance, and they also can conduct assessments, because when doing a master's in counseling psychology or a specialization in counseling psychology, you are given training and practical exposure in dealing with the clients and conducting assessments. But the focus here is not directly related to diagnosis and treatment of mental illnesses. It mostly revolves around day-to-day issues like mild to moderate problems, like I mentioned. Again, there are a lot of debates emerging up on this topic, and hence I refer to very authentic sources to provide you with. Now coming to a psychologist. Now many people say that how do I call myself as a psychologist? How does it qualify, and when can I call myself as a psychologist? What will be my job role? Can I start seeing clients? So to be very honest, many organizations and associations in India, they see whether you have undergone any practical training in dealing with clients, like have you worked before with any kind of counselor or clinical psychologist, and based on your experience they do provide jobs in their mostly it is seen in online platforms, that you have a master's in psychology and you have studied counseling psychotherapy as special papers within your course, and you have relevant amount of internships and experiences, and they do appoint you, not directly in a hospital setup. I haven't seen personally, but you are not a clinical psychologist, you are simply a psychologist. And if you have specialization in counseling, then of course you qualify as a counseling psychologist in that matter. Psychologists can also work along with other counselors. Sometimes they do internships under clinical psychologists and psychiatrists as well. Independently seeing clients, personally I wouldn't recommend, because I myself am a psychologist, but I do not see clients on a personal basis as of now. I aspire to do my MPhil from a RCI recognized college and then practice as a clinical psychologist. But the job roles of a psychologist could be in any kind of NGO, especially around work revolving any kind of psychoeducation or desensitization of a mental health related topic to other people, conducting a lot of workshops, organizing events. Then they can work in organizational setup, in recruitment, like basically the training and development of employees. So I have colleagues who are actually working in an organizational setup. And of course, if you are have done a master's in psychology and you have specialized in different courses, like it could be anything, art based therapy, it could be any kind of skill that you have intensively learned, and you have a appropriate certification for that, so that can be used at present in whichever sector you are working with. Or of course, if you aspire to pursue higher studies and then practice as a clinical psychologist, you can amalgamate that with your practice, whatever, if it is a therapy that you are specialized in, right? So this was something that I have taken from all the sources which I have read, and I thought that it would be great if I can share it with you all. I hope I clarified the common assumptions or doubts that we have around these four categories of individuals. In case you have any questions, please put them in the comment section, and stay tuned for more such informative videos. And those who haven't subscribed to my channel, please subscribe to my channel and support this initiative, and also share with as many people as possible. Thank you. Have a lovely evening.